Inflammation. It is defined as the local response of the living mammalian tissue in injury form due to agent. Cause of inflammation. Infective agent, bacterial, virus, fungi, parasite, etc. Immunological agent, antigen-antibody reaction, cell-mediated reaction. Physical agent, heat, cold, radiation, mechanical trauma. Chemical agent, organic and inorganic, poison, inert material, foreign bodies. Cardinal signs of inflammation. 1st century AD, Celsus gave 4 cardinal signs: rubor, redness, tumor swelling, calor, heat, dolor, pain. 5th signal was later on added workout. Function, Lisa, loss of function. Type of inflammation: acute inflammation, chronic inflammation. Acute inflammation, it is short duration, lasts less than 2 weeks. It is present as early body reaction and resolves quickly. Its main features include accumulation of fluid and plasma at the affected site, intravascular activation of platelets, polymorphonuclear neutrophil as inflammatory cells. Chronic inflammation, it is the comparatively longer duration. It is caused after the causative agent of acute inflammation or by the stimulation which induce chronic inflammation from the beginning. It's mainly involve chronic inflammation cell such as lymphocyte, plasma cell, macrophage, granulation tissue form cell. Acute inflammation, vascular event, cellular event. Vascular event, hemodynamic changes, alter vascular permeability changes. Cellular event, exudation of leukocyte, phagocytosis. Vascular event, alteration in macrovascular stimulant like artery, venule, capillary are the earliest response of the tissue injury. These alterations mainly include hemodynamic changes, alter vascular permeability, hemodynamic changes, transient vascular vasoconstriction, persistent progressive vasodilation, elevated local hydrostatic pressure, leukocytic margination. Irrespective of the type of cell injury, the immediate vascular response starts with transient vasoconstriction of the arteriole. In mild injury, it may get reestablished in 3 to 5 seconds, which is more severe injury. It may last for about 5 minutes also. Next, informed by persistence progressive vasodilation. This vasodilation results in increased blood volume in the blood vascular area. Due to this progressive vasodilation, the local hydrostatic pressure may elevate, result in the transduction of the fluid into the extracellular space. It further followed by the showing of stasis of microcirculation with cause increased concentration of red blood cell. It is followed by the leukocytic margination along the vascular endothelium, alter vascular permeability changes in and around the inflammation tissue. This is a region of edema fluid in the interstitial compartment. Pattern of the increased vascular permeability, constriction of endothelial cell. The endothelial cell by develop temporary gap between, resulting in vascular leakness. Example, immediate transient response in mild thermal injury to skin of forearm, mild endothelial damage. In this mechanism, there is structural reorganization of endothelial cell causing mild form of endothelial damage. Delay or prolonged leakage in sunburn mediated ultraviolet radiation. Direct injury to the endothelial cell. The direct injury to endothelial cell lead to cell necrosis and appear of physical gaps at the site of detached endothelial cell to serve burn injury. Leukocyte-mediated endothelial injury. Adhesion of leukocyte to the endothelial site. Inflammation may cause activation of leukocyte, and this activation leukocyte release the proteolytic enzyme and peroxide, leading to endothelial injury and vascular leakness. Leakness in vascularization. This newly formed capillary under the influence of vascular endothelial growth factor VEGF during the process of rapid and excessively leaky cellular event. Exudation of leukocyte. The escape of leukocyte from the lumen of microcoagulation into the interstitial tissue take place following process. Change in form, element of blood, marginal power-mating, rolling and adhesion of leukocyte, immigration of leukocyte, chemostasis by leukocyte, change in form of element of blood. The central stream of blood flow, cell flow, inflammation blood is composed by leukocyte and RBC. Whenever there are inflammatory changes, this central stream of cell widen, peripheral zone, plasma become narrow. This phenomenon known as margination, and the leukocyte of the central column close the vessel wall. This is called as pavemating. Rolling and adhesion of leukocyte. The peripheral marginated, pavamented leukocytes slowly roll over the endothelial cell lining in the vessel wall. The transient bond between the leukocytes and endothelial cell start become femur adhesion phase. The following molecular bring around rolling and adhesion phase, selecting entering immune globin gene superfamily adhesion molecule. Immigrating of leukocyte. After sticking of leukocyte to the endothelial, they move along the endothelial surface till a suitable site between the endothelial cell is found where the leukocyte throughout the cytoplasmic pseudopods. These cross the basement membrane by the damaging it locally, escape out into the extravascular space. Immigration. Chemostasis by leukocytes. After immigration of blood vessel, these leukocytes migrate toward the site of infection or the injury along a chemical gradient by process called chemostasis. Patent chemostasis substances include cytokinin, interleukin, leucokinase B4. Phagocytosis. It is a process of engulfing of solid particle material by the cell. The cell perform this function are known as phagocytes. Two main type of phagocyte cells are polymorph nuclear neutrophil BHMS macrophage. Phagocytosis take place in following step: recognition and attachment, engulfment, killing, degradation. Recognition and attachment. Phagocytosis is initially by expression of surface receptor or macrophage. It is the further enhanced when the target cell or microorganism are coated with specific protein called opsoning. The process and the cell opsonization meaning preparing for eating. Major opening are agious opsonin, C3b opsonin, lactins. Engulfment. Formation of cytoplasmic pseudopodia around the target particle initiate the process of engulfment. Further, eventually the phagosome tissue with one or more lysosome of the cell to form the phage lysosome. Killing and degradation. The microorganism get killed by the bacteria. Cidal activity of the enzyme pyrodes, and it is further degraded with the help of Hydratic enzyme. The disposal of the microorganism take place with the help of oxygen-free radical, lysosome granule, immune mechanism. Mediated of inflammation. These are various endogenous substances which mediate the process of acute inflammation. Mediated of inflammation, cell-derived mediator, vasoactivamine, arachidonic acid metabolite, platelet activating factor, cytokine, free radicals, plasma protein derived mediator, kinase system, clotting system, fibrinolytic system, complement system. Cell-derived mediator, vasoactivamine. These are activamine which have important role in early inflammatory response. Histamine. These are stored in granule of mast cell, basophili, platelet, etc. Major action of histamine are vasodilation, increase vascular permeability, itching, pain, etc. They get released by stimulus through heat, cold, trauma, allergen, irritant chemicals. Serotonin. The active of serotonin are similar to the histamine, but it is comparatively less potent in vasodilation and vascular permeability. Neuropeptidase. It is mainly include substance P, neurokinin A, somatostatin, etc. Arachidonic acid metabolites. These are the most protein mediated of inflammation. This act by causing vasodilation, increase vascular permeability, platelets aggregation, etc. Prostaglandin, PGD2, PGE2, PGF2X, thromboxane, prostaglycin, leukotriene, lysotoxin. Platelets activating factor. These are released from IgE synthesized basophils, mast cell. These mainly act by leading to chemotaxis, adhesion of leukocyte to endothelium, bronchoconstriction, vasodilation, low concentration, increased vascular permeability. Cytokinin may are polypeptide substance produce activate lymphocytes and activate monocyte. Major cytokinins include interleukins. These are naturally occurring protein which mediated the communication between the cell. Interleukin regulated the cell growth differentiation mostly. Example IL-1, IL-6, IL-8, IL-12, IL-17. Tumor necrosis factor TNF proportional to beta. They are multifunctional cytokinin which play important role in various cellular events like survival, proliferation, differentiation, and cell death. Interferon. They are produced by T cell and natural killer cell. They activate the macrophage, stimulate secretion of immunoglobulin by beta. Free radical. Free radical are potent mediator of inflammation. They are endothelial damage. They by increase vascular permeability, microvillar action, damage to the other cell, superoxide oxygen, peroxide, nitric oxide. Lysosome component. They are mainly secreted by neutrophil and monocyte. Lysosome component may include diploid, elastase, protease, plasminogenase, activate. Plasma protein derived mediator, kinase system. These are mediated through the bradykinin which act by leading to stomach muscle contraction, vasodilation. Clotting system lead to formation of fibrin, fibrin peptide, fibrogenous system, histamine mediated by plasmin. Plasmin act by breakdown of furin to form fibrinopeptide or fibrins spill product. Complement system play an important role in host defense through immune mechanism. Inflammation. The action of complicated system mainly include opsonization, chemotaxis or leukocyte, release of histamine.